Hi, this is Damaris, and I'm going to be performing my head to toe assessment. I'm going to start by performing hand hygiene. And then I'm going to dry off, and then I'm going to head into the patient's room. May I come in?
Yes.
Hi, my name is Damaris, and I'll be a nurse for today. I'm just going to go ahead and close the door behind me for privacy. Okay, and just before we start, I just want to ask if I have consent to record this video.
Yes.
Okay, perfect. So I just need to verify your name and date of birth.
Tina Banks, May 11, 2006.
Okay, and just go ahead and check that. Okay, perfect. So, Tina, I see that you're in for a head to toe assessment exam. Is there any other complaint? Are you having any problems right now? No? Okay. Well, what I'm going to want you to do is I'm going to go ahead and have you sit up here against the bed. Okay, perfect. So the first thing I'm going to do is I'm going to start by inspecting her overall appearance. Her level of consciousness is good. Nothing indicating to me that she's having any neuro issues or anything like that. Her skin type is a skin type probably 4, maybe 5, but mostly 4. I don't see anything that would alarm me of her skin. I don't see any apparent lesions right now as I'm inspecting. Her head looks symmetrical. Ears are good. Everything's good. The first thing that I'm going to do is I'm going to go ahead and start with the scalp. So I'm going to use a tongue depressor. Normally I'd use gloves on a different patient, but since this is my sister, I'm just not going to do that. So the first thing I want to do is I want to inspect the scalp. So I'm just going to inspect for any lesions, anything that will alarm me, any bugs or anything like that, and just thoroughly inspect the scalp. Okay, I'm also noting that she has dark brown, really, or black, thick, smooth textured hair, not brittle at all, not thin. Her hair pattern is normal. I don't see any signs of her receding hairline or any bald spots, so the distribution of her hair is good. And now I can go ahead and begin to palpate. Just to palpate the scalp for any lesions or anything I feel like that. Like I said, I would use gloves, but it's my sister, I'm not going to. Any knots or anything like that. And now that I did that, I'm going to go ahead and let me just fix this. I'm going to go ahead and start with her face. So I'm going to go ahead and just palpate her head for any bumps or anything like that. I'm also going to palpate her sinuses for any tenderness, the frontal and maxillary. And while I'm here, I'm going to go ahead and palpate the lymph nodes. So auricular, postauricular, occipital, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Are you feeling any tenderness or anything like that? No? Okay. And now I'm just going to go ahead and look at her brows. Anything like that? No. So I'm going to start with the ears. And I'd usually take a light source and inspect the ear for any blockage or anything, but I don't. I have a light source actually right here. So I don't see anything. I'm also going to be inspecting the outer ear, Darwin's tubercle, any drainage, and just palpating that for any pain, tenderness, or any bumps. Also doing that bilaterally. Okay. Also checking behind the ear as well. Okay, and so now I'm going to assess one of the hearing tests. So I'm gonna actually whisper 3 words on one side of the ear and have her cover the other side. Okay?
Light, tight, dynamite.
Okay, and then I'm actually gonna just stand over here because I can't physically get over there. Okay.
Dog. Oh wait, car, dog, cat.
Okay. Perfect. So I did the light tight dynamite, so that also assessed her tongue muscles as well. So that's good. And then I'd also do the Romberg's test, but I'm gonna have her do that later. Okay, so now I'm gonna go ahead and start with the eyes now. So inspecting her eyes. I'm gonna go ahead and just look at them. They're symmetrical. I'm gonna go ahead and palpate right here, making sure that there's no drainage from the lacrimal apparatus. I'm gonna go ahead and pull this up, inspect the sclera for any redness, and then I'm gonna go ahead and pull this down, inspect the conjunctiva, any drainage, any excessive redness or anything like that. So everything's normal. And now I'm gonna do Perla. So with Perla, I'm gonna go like this, and I'm gonna bring the light. Check for equal reactive, pupils are equal reactive around to light. And then I'm gonna check again for consensual constriction. Okay, they did. Other side now. Okay, perfect. And then I'm going to check for consensual constriction. Okay, it's good. And now I'm going to test accommodation. So I'm going to have you stare off right there.
Where?
Anywhere. And then just stare at it for a bit, and then I want you to focus on this. Okay, the pupils did dilate, so that means that her eyes were able to dilate to enable more light to focus in. So now that concludes the eye. Actually, the last test I'm going to do is the corneal blink test. So I'm going to have you, I'm going to take a cotton. I'm going to have you look over there. And then slowly, okay, she blinked a little bit. And now look over there. Look over there. Okay. And then normally we test visual acuity with a Snellen chart 20 feet away, but I don't have a Snellen chart. So with that, we just cover one eye, and then we'd have the patient read the most comfortable line they can read at 20 feet away, and then we would measure the other eye and then do both, and then we would grade it. Normal vision would be 20, 20. And then now we're going to go ahead and do kinetic confrontation to check her visual fields. I'm going to go like this, and I'm going to have her tell me when she sees my fingers.
Right there. Right there. Right there.
Okay, perfect. So now the last thing is cardinal fields of gaze. So I'm going to have you follow my finger without moving your head. Okay, perfect. So I didn't see any shakiness or anything like that. That would alarm me. And now I'm going to go ahead and go to the nose. So I'm going to go ahead and look up the nose for any polyps, any inflammation, redness, or anything with the turbinate. Nothing. Any deviated septum. I don't see anything like that. I'm going to have you cover one nostril. Breathe in. Okay, other nostril. Breathe in. Is that a little congested? Yeah, okay. And then now I'm going to go, you could also test smell here, but I'm not going to do that today. And then I'm going to go to the mouth. So I'm actually going to take another tongue blade. I'm running out of time. But I'm going to go ahead and have her open her mouth. Say, ah. Okay, good. The uvula rose symmetrically in midline. Now I'm going to have you open your mouth. Smile. I'm just checking the gums and the teeth. Making sure there's nothing like any sores or anything like that open. Checking the buccal part of the cheek. Can you flip your tongue up? Okay, good. And then I'm gonna say, so say ah. Take a deep breath. So I was testing the gag reflex, but I wasn't able to do that. But normally I would be able to, and I would discard this. And then I'm going to now go ahead and have her make some facial expressions. So wrinkle your forehead, raise your eyes really high, smile with your teeth, smile without your teeth, frown, frown, press your lips, make a duck face, and puff out your cheeks with air. Okay, perfect. And then now I'm gonna go ahead and have her memorize 5 words. So I want you to memorize these 5 words for me, okay? We're gonna do horse, blue. I'm gonna write these down. I also don't wanna forget. If you had a pen. Okay, horse, blue, car, horse, blue, car, tape, horse, blue, car, tape, and dollar. Horse, blue, car, tape, dollar. Okay, can you say it for me?
Horse, blue, car, tape, dollar.
Okay, again.
Horse, blue, car, tape, dollar.
Okay, do you know it? So I'm gonna ask you that at the end of the assessment. So now let's just check your, go ahead and just palpate your trachea to check the neck. And while I'm here, I can also assess her carotid, so I'll just go ahead and find that. Her carotid pulse. Okay. And I forgot to mention that I had taken vitals already. Her blood pressure was 110/64, heart rate was 58, respiratory rate was 12, pulse ox was 99%, temperature was 98.7, and yeah, I believe those are all the vitals. And general history was already taken as well. And so continuing on, so I palpated that. I'm going to check that for peripheral vascular later. So I'm going to actually have her do range of motion. So chin down, chin or head back, to turn right, turn left, ear to shoulder, shrug your shoulders. Okay, and now I'm going to do with resistance, okay? So you're going to put your chin down, don't let me push up. Okay, good. Head back. Okay. Okay, turn. Okay, good. Turn. Okay, good. And now ear to shoulder. Okay, good. Ear to shoulder. Good. Okay, and now bring your shoulders up. Okay, good. And then can I have you just squeeze my fingers really hard? Okay, good. And while I'm here, while she's sitting, I'm actually going to do the upper extremities. So I'm going to go and inspect her skin on her arms, making sure she doesn't have any lesions. Her skin texture is cool, no signs of cyanosis, and her skin texture is smooth, cool. Yep, it's good. Now I'm going to check cap refill. It's about 2 seconds, which is what we want. Okay, that's good. So we already tested her hand strength, and actually gonna have your forearms go like this. Let me inspect this first. Okay, forearms are like this. I'm gonna push forward, you push back. Okay, and I'm gonna pull, you pull back. Okay, perfect. So now I'm gonna go ahead and begin to inspect her lungs and her chest. So can you go ahead and breathe in for me? I see symmetrical chest rise. Keep breathing. I don't see any accessory muscles being used to breathe. Breathe in. Good. Breathe in. Good. Okay, so her anterior posterior chest expansion is good. Her anterior to posterior ratio is normal. I don't see anything that's alarming. And then I'm going to go ahead and also palpate for any crepitus, 3 heaves or thrills. I don't feel any. I'm going to go on the back too. Okay, and now I'm going to go ahead and auscultate her lungs. So if she's congested, I'd go ahead and let her know to cough, but she's fine. So I'm going to have you breathe in. I'm going to start supraclavicularly, so breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, good. And I don't recommend, I know usually we'd have their top removed, but for the purposes of this video, I'm just going to have her leave it on. So I'm going to start above the scapula to auscultate her lungs in the back. Here you go. Okay, perfect. So I don't hear any abnormal breath sounds, so that's good. So now the lungs have been assessed, and now I'm going to go ahead and assess cardiac as well. So I'm going to go ahead and auscultate her heart. So I'm going to start locating the second intercostal space and begin to listen for a full cycle. Across. First point. Down. And I like to go one more extra, just down. Okay. So she has a normal heart rhythm. I don't hear any gallops or any murmurs or anything like that. So that's good. And while I'm here, I'm actually going to go ahead and palpate her carotid again. And then I'm going to check for bruise as well later. So I hear it. And then I'm going to also have her lie down for me. And I'm just going to have her lie down more lower. Okay? And I'm going to check for her point PMI at the apex of her heart. Look out the horizon. So I can see it. It's right here. I'm going to go ahead and palpate it, and then I'm going to auscultate. And I'm going to go palpate her brachial or radial. Checking for any deficit. And I'm going to also palpate her brachial. Okay, and those pulls, both her brachial and her radial are going to be a +3. And then now I can go ahead and have her, can you extend your neck for me? I'm going to go ahead and check for jugular distension, which I don't see, and listen for Broe in the carotids. Can you hold your breath for me? Okay, you can breathe. Hold your breath. Okay, good, you can breathe. And now I'm gonna do the abdomen. So I'm gonna go ahead and lift up her shirt. Just inspecting the overall contour. It's flat. I don't see any lesions or anything. The umbilicus, checking that it's not inflamed or anything like that. I'm gonna start by going ahead and auscultating the 4 quadrants for signs of bowel movements. So a hyperactive bowel, normal active, or hypoactive. So I'm gonna wait until I hear some gargling. Okay. Okay, good. And now I'm going to go ahead and begin to palpate her abdomen. Here, I'm just going to go do a light palpation, just to feel also any tenderness or anything like that. And then I can actually, in a more advanced, you can actually go ahead and feel for the liver and the spleen. So I'm going to do deep palpation for that. And then I'm also going to check for rebound tenderness and see if that hurts. Does that hurt?
No.
Feels weird?
Yeah.
Okay. And then I'm also inspecting the abdominal aorta right while I'm here. I can actually palpate deep. Take a deep breath. And feel the pulse. Okay. So I went ahead and did that. While I'm here, I also going to go ahead and I palpate the femoral pulse, but I can't do that through her genes. And I also feel the inguinal lymph nodes. I'm actually going to have her raise her armpit for me. I'm going to go ahead and palpate for axillary lymph nodes while I'm here, because I didn't do that earlier. Okay, good. Okay, and so I went ahead and finished the abdomen. I'm going to have her sit up. Stretch your leg right here. And then I'm going to do CVA tenderness. So I'm just going to go ahead and just tell you if it hurts. No? Okay. No? No? Okay, good. So now I'm going to do the lower extremities. So actually, I'm going to go ahead and have you lay down again. Sorry. And we're going to check range of motion for her hips. So let me rock the hips really quick. Is it hurting? Okay, so I'm going to have you lift your leg up, across, out. Okay, bend the knee. Okay, across, back, and down the shin. Okay, and then now the other leg. Up, out, or across, sorry. Back, knee, out, across, down the shin. Okay, so that's good. Now I can go ahead and test the range of motion of her knees and her calf and foot strength. So what I'm going to have you do is I'm going to go ahead and hold these. You're going to try to push forward, okay? Okay, good. And try to pull back. Okay, now point your toes, palm against them. And try to point your feet. Okay, good. And try to flex them now. Okay, good. So, that concludes her sitting portion. Now I'm going to have her stand. Okay, so what I'm going to do is the Romberg's test. So I'm going to have you close your eyes and stand still. I'm going to go ahead and guard. Okay, I don't see any swaying, so you can open your eyes now. And then now I'm going to go ahead and have her bend forward. Like you're going to touch your toes. And I'm inspecting the scapula on the horizon for any asymmetry. No, I don't see any. I'm going to go ahead and palpate the spinous process while she's down here and have her go up. I don't see any signs of kyphosis or anything like that. Okay, good. And now I'm going to have you bend forward to touch your toes. Go all the way back.
What?
Like this.
Oh.
Okay, now go ahead and side. Turn. Turn the other way. Okay, good. And then now I'm going to go ahead and have you practice your gait. So I just want to see you go ahead and walk normally. Okay, and back. Okay, forward. Okay, perfect. And then now I want you to do heel to toe, heel to toe. Heel, yeah.
Okay.
Okay, and then go back that way. Okay, and then now we're gonna do the Trendelenburg test. So I'm gonna have you go ahead, come here, and lift one knee up like this. One knee up like that. Okay, go down and up.
Same one?
Yeah, left. Yeah, so I'm just checking for any, if her hip's dropping down. I don't see anything. And then I have 2 more tests I need to do, so I'm gonna go back, have you lay down over there again. Thank you. And I'm gonna go ahead and take something like this. And I'm gonna do the Babinski sign on her foot. To see if it's normal. Her toes shouldn't curl, or shouldn't flare. Okay, is that good? Okay, and then I'm gonna go ahead and just inspect her legs. I'm gonna take the sock off right here. And inspect the toes, check calf refill. Okay. And since she has jeans, I'm just gonna inspect her here. But normally the patient would be wearing a gown, so I can inspect the legs for any lesions. Palpating. Are you feeling any tingling, tenderness, numbness?
No.
Okay, perfect. And then the very, very last thing that I should have done earlier, but I forgot. Or actually, I'm going to go ahead and palpate her pedal pulse. Okay, got it. And then her medial malleolus. Okay, and then her popliteal. Okay. And now I can go ahead and do the last test that I should have done earlier. So I'm gonna have you sit up again. This is our last thing. Lastly, I'm gonna do the Sharp and Dill test. So I'm gonna go ahead and break this. Okay. So I'm just gonna do this. Okay, broken 3. Making sure I don't have something that's too sharp. Okay, this is good. Okay, so I'm gonna have you tell me sharp or dull. Okay, so this is what sharp feels like, and then this is what dull feels like. Okay.
Close my eyes.
Yeah.
Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Sharp.
Okay, so that was the last test, and so everything is good there. And now I'm just gonna have her repeat the 5 words back to me.
Horse, blue, car, tape, dollar.
Okay, perfect. So that concludes my head to toe exam. I'd go ahead and just brief the patient on anything, do teaching, and things like that. So thank you.